Chapter 1 Episode 24. Have you ever stood up and suddenly felt like you might faint? That's usually what people mean by lightheadedness. Unlike vertigo, where you may feel that you or the room is spinning, lightheadedness often feels like you're about to pass out. But why does it happen? When you stand up, gravity pulls some blood toward your legs. Normally, your heart, blood vessels and nervous system quickly adjust to keep enough blood flowing to your brain. But if that adjustment doesn't happen quickly enough, you may suddenly feel lightheaded. And blood flow isn't the only possibility. Oxygen delivery, blood glucose, medications and heart rhythm can also play a role. Lightheadedness can happen to anyone, but it becomes especially important as we get older. Our bodies may become slower at adjusting blood pressure when we stand. Dehydration can reduce blood volume. Some medications can lower blood pressure. Diabetes can affect the nerves that regulate circulation. Anemia or blood loss can reduce oxygen delivery, and abnormal heart rhythms can temporarily reduce blood flow to the brain. Before ordering lots of tests, start with the story. Did it happen after standing up? Had you eaten? Were you dehydrated or overheated? Did you recently change a medication? Was there bleeding? And did your heart suddenly race, slow down, or feel irregular? These clues help determine what should be checked next. One important test is blood pressure while lying down, and again after standing. A drop of at least 20 points in systolic pressure, or 10 points in diastolic pressure within 3 minutes, can indicate orthostatic hypotension. Doctors also check your pulse. And if a heart rhythm problem is possible, an ECG, a simple test that checks your heart's electrical activity and rhythm, may tell us more than a blood test. Do you need every possible blood test? Usually, no. If anemia or blood loss is suspected, a CBC and hemoglobin may help. If glucose is a concern, check blood sugar. If you're dehydrated, sick, or taking certain medications, electrolytes and kidney function may be useful. The tests should follow the clues, not the other way around. What about something inside the brain, such as a brain cyst? A brain cyst can cause dizziness or balance problems if it affects surrounding structures, but this is much less common than causes such as blood pressure changes, dehydration or medications. And many brain cysts discovered on scans cause no symptoms at all. That's why a CT or MRI isn't routinely needed for simple lightheadedness. But persistent unexplained symptoms, especially with neurological changes, may lead the doctor to consider brain imaging. One brief episode after standing quickly or becoming dehydrated may have a simple explanation. But if lightheadedness keeps returning, becomes worse, has no obvious cause, begins after a medication change, interferes with daily activities, or you actually faint, it's time for medical assessment. But some symptoms shouldn't wait for a regular appointment. Lightheadedness accompanied by chest pain, trouble breathing, a rapid or irregular heartbeat, fainting, a sudden severe headache, weakness or numbness, difficulty speaking, sudden vision changes, or severe difficulty walking requires urgent medical attention. These symptoms can sometimes signal a serious heart or neurological problem. So remember, lightheadedness is a symptom, not a diagnosis. Don't begin by asking, which blood tests do I need? Begin by asking, what was happening when I became lightheaded, and what clues could explain why? Those clues help determine whether the next step is as simple as hydration and a blood pressure check, or whether further heart, blood, or neurological evaluation is needed. Understanding the symptom is the first step toward finding the cause.